So for weeks, coronavirus cases have surged across the U.S., but specifically we're seeing spikes in the sunbelt. And now not just cases, but deaths are on the rise in these areas. 3 states have recorded their highest daily death toll since the pandemic began. And there's evidence that the jump may be linked to reopenings. States with big case spikes since reopening include Arizona, South Carolina, Georgia, and Texas. Florida has had the biggest surge with a nearly 1,400% jump. And despite that, despite the hospitalizations, despite the death toll climbing at a record pace, Disney World is set to reopen its doors to the general public tomorrow. Laura Podesta has the latest developments.
Florida reported its highest single-day death toll yesterday.
You should take precautions, but there's no need to be panicked. There's no need to be fearful.
120 people died from the coronavirus, bringing Florida's total to more than 4,000. Hospitalizations are also growing at a record pace.
Back in April, and this is now. This is how many admissions that we're having to our hospitals with COVID diagnosis. It is double what it was at the beginning of April.
Hospitals are being sent additional nurses and staff to help manage the influx of patients.
We're going to try adding another person to our group during the day, so we'll have extra people here. But the workload keeps increasing.
Texas reported more than 100 deaths for the first time yesterday. Houston health officials warn the total could be higher because people dying at home might not be tested for COVID-19.
For those of you who are looking at the number of COVID-related deaths and saying, well, the number's not bad, it may very well be an undercount. And our colleagues in New York saw the same phenomenon.
Dr. Anthony Fauci says he hopes states don't need to shut back down.
I would think we need to get the states pausing in their opening process.
Nevada is closing bars in parts of the state, including Las Vegas.
We know that COVID can easily spread when people are congregating for long periods of time.
Another hotspot, Arizona, will limit indoor dining to 50%.
We have had a brutal June.
The state has less than 200 ICU beds available. Laura Podesta, CBS News.
So cases are going up in some areas, hospitalizations going up in some areas, and researchers from the Harvard Global Health Institute are now calling on some of these states to perhaps consider reinstituting a stay-at-home order. So let's talk about this. Will that even make a difference? Let's bring in Dr. Bob Lahita, who is, of course, following all the latest developments for us from New Jersey. So, Doctor, the CDC is now predicting that by mid-July, we could be seeing about 140,000 to 160,000 deaths because of COVID-19. A number of the states where things are spiking have reopened, and though some governors have suggested a pause in moving forward, we're hearing other experts say, I think we need to roll things back completely. I gotta ask you, rolling things back, is it too late at this point? Are there things that we can do to bring the CDC's death predictions down?
Well, rolling back now is a very good idea in those areas where spikes are happening. You're absolutely right. Those who are infected are now going to manifest their infections over the next 10 days. And we're going to see tremendous deaths occur in those particular states. What we saw in the Northeast, if you recall, was we saw lots and lots of deaths until we took this seriously. And I think the governor of New Jersey, certainly, and the governor of New York mandated that everyone wear masks, including outside, not just in closed spaces. But in the South, what they've done is seemingly opened restaurants, barber shops, gyms, etc. Back in April, I think I was seeing this happening, and then just recently, we remember Georgia. Remember Governor Kemp of Georgia having opened stuff up, and now he's reaping the effects of doing that. And so it's not an embarrassment. It's a politicization of quarantining and of mitigation. It's not an embarrassment to close again if you're going to save hundreds and hundreds of lives. And that's where we are right now. We're at the position where we either save lives or we go forward and say, well, that's the collateral damage of being able to go to a restaurant or to a gym, etc. And that's unfortunate from a medical standpoint.
Yeah, definitely. Of course, we talk in numbers, but we're not talking about numbers. We're talking about human beings with families, with hopes and dreams. We're talking about tremendous loss. It's not just a matter of numbers. And one of the things that we're sort of seeing now, thanks to the release of some documents, is that a number of these cases, a number of these states that reopened consulted businesses when determining the sorts of guidelines they were going to implement. And it makes sense. You should talk to salon owners about, how they conduct their business to determine what can be safe and what cannot be safe. What you don't want are industries having too much influence over these guidelines, because this is about public safety. And yes, keeping the economy healthy is important, but you can't keep the economy healthy if the public isn't healthy. So I want to ask you, Doctor, all sorts of businesses are different. I get it. And I certainly have questioned why some businesses opened earlier than others. For example, tattoo shops and massage parlors that seem very, very intimate and require very close exposure to the customer for prolonged periods of time. I don't get it, but maybe you do. If you could give sort of an umbrella list of guidelines, the top 3 or 4 things that every business should consider, no matter what business it is, before they think about reopening, what would you say?
Well, I agree with you. I don't understand why gymnasiums and tattoo parlors in particular have been chosen to open. But I understand that some of these meetings at the governor's mansions have included 8 business people versus 1 epidemiologist or 1 doctor. And so the healthcare professionals have been sort of pushed to the side. This becomes an economic issue right now. And prioritization for a lot of the governors are to get the economy rolling again. That may be the whole business of bringing kids back to school as well, which I think is not a bad idea. But opening businesses like tattoo parlors and gyms where people are shouting and screaming, or as you just showed on your screen, barber shops and gambling casinos, all of these are areas where people yell, scream, and they sweat, and they push their vapors, if you want, for no other reason. They push their saliva onto other people. That saliva could well be infected. And that's what we're seeing. We're seeing the result of this, I wouldn't say irresponsible, but it comes close to irresponsible reopening until we have absolute proof that the disease is under control. Now, I have to tell you, in the Northeast, again, we had horrendous numbers. We had horrendous death numbers. We are now in a sort of stable position, and we don't want to see a recrudescence of this infectious process going forward. I'm afraid that when we have travelers coming from the South to the North, that they may be bringing COVID with them again, and we may see a second wave. I don't want to see that. So I'm hoping that the governors use some common sense and close up again. They're obviously worried about litigation, and they wanted to have the CDC mandate masks early on, which would not have been a bad idea. That didn't happen. It did happen at local levels. Some governors mandated wearing masks, such as in New Jersey and in New York, but it's not the case in the sunbelt. And that's why we're having many, many more deaths down there.
Yeah, you mentioned that governors are being concerned about litigation. What that reminds everyone is there are so many other factors being considered that don't have anything to do with public health when it comes to moving forward, whether it's the industries. And I was thinking about the number of businesses that received that PPP money, and these business owners have to spend a portion of it on the salaries of their workers. And if they don't, then they either have to give it back or whatever. And so there's a push to get businesses open. One area where I think you see a lot of businesses opening now has to do with restaurants and particularly outside dining. But I've been out to a restaurant once since you were allowed to do that here in Philadelphia, and I was kind of confused because I felt like the tables actually weren't 6 feet apart at all, and I didn't see anyone wearing masks other than the staff. And I didn't find the staff were really keeping their distance either, though they were all masked. And I realized that, as a customer, I sort of depended on the business to do the right thing. I figured, they don't want a case of COVID popping up in their business, so they're probably pretty vigilant, even though it doesn't appear as if that's the case. So I want to ask you, as a patron, restaurant patrons, if we're taking matters into our own hands, what should we do? You're sitting at the table, you're waiting for your drinks or your food. Do you keep your mask on? What's the protocol?
Oh, well, that's a very good question, Anne-Marie, because like you, I have been to 2 outdoor restaurants, and I have been making sure that we've had safe distancing. But as soon as I sit at the table, I take my mask off, as does my wife. And what we have is a waiter wearing disposable rubber gloves and a mask. Everybody that serves the table is dressed to the teeth with mitigating PPE. But again, we sit there, no masks, and the adjoining tables are all without masks. So it's a personal call. I mean, it's hard to wear a mask and eat and drink outside, but it is probably a safe thing that we're outside, and it's an excellent thing that the wait staff, the chef, that the maitre d' are all wearing PPE. So I think that's pretty good and pretty safe. We will see. So far, knock on wood, we've been lucky and have not had a rash of infections at the various restaurants in our area. We would have heard that epidemiologically if that had happened.
Mm-hmm. I think that's really good advice, and I think as we continue to talk to you over the next few weeks, I'm going to be asking you about specific situations and specifically what to do. I think people need to know that when it comes to sort of risk factors in terms of where you're going, a place like a beach, which is really wide open, may seem pretty safe, but one of the key differences is there's no protocol for a beach versus perhaps a restaurant where businesses are required to follow protocol, and that also has an impact on the risks that you're facing.
Right, and you have to know that the good news of being outdoors is that's very, very or relatively safe. We've seen spikes in infections in synagogues and churches when people go and there's not safe distancing, and those are closed spaces with minimal ventilation. It's always important to have ventilation, even when you're in a closed space like an office where you're sharing office space or with cubicles with several people working together. Make sure the ventilation is good, and all of those people should be wearing masks and keeping their safe distance. But outdoors is a little bit safer, and hence, eating at an outdoor restaurant when the wait staff and the maitre d' are well protected is probably a safe thing. I don't worry about it as much as I do in closed spaces.
Mm-hmm. All good information. Dr. Bob Lahita, thank you so much.
Thanks, Anne-Marie.